Good afternoon, Dr. Simmons' office.
Hi, I called. I wanted to find out. Recently, my kids were complaining about me snoring at night, and I have some lapses. Are you guys treating such a thing?
Oh, absolutely. Dr. Simmons hears this every day, and I'm sure he can help you.
I would like to schedule an appointment. Do I need to bring my insurance?
If you can please fax us your name, date of birth, and insurance information, we can check it out for you.
Yes, please. I would love to fax the insurance cards to you.
What day is best for you?
I would love to schedule it for Wednesday at 10:30.
Yes, I think we can get you in at that time. Great. We'll look forward to seeing you then. Have a nice day. Bye-bye.
Hello, I made an appointment for today with Dr. Simmons.
Yes, hello, it's Dahlia, right? Nice to see you, Dahlia. I have some paperwork for you.
Great, thank you so much. I'll fill them out.
The doctor's ready to see you now.
Thank you.
Right this way.
Thank you.
Welcome. It's nice to meet you. So, Dali, this is the first time you have with being at this office, so thank you so much for filling out the paperwork. Can you tell me a little bit about why you've come to see me?
Yeah, my kids were complaining that I'm snoring lately, and that I have those lapses suddenly, like it's kind of a little bit of like choking, I would say. I don't know, because I don't hear myself. And I just thought it would be a good idea to get an opinion about it.
So, your main concern is snoring
Yes,
and lapses in breathing.
yes.
And how long have you had that going on for?
I can't tell, but just I've been hearing it lately from the kids, so let's say maybe half a year.
Okay, about 6 months. And the lapses in breathing, are they something where the kids get worried about you and have to wake you up?
I guess it's bothered them, so they do
Okay.
wake me up.
And so before then, 6 months prior to that, you don't think you were snoring, or you just didn't get reports?
I didn't get any reports.
So right now you don't have a bed partner that can give you that information?
Correct.
Okay. So in the morning when you wake up, do you feel well rested?
Sometimes, I wouldn't say all the time.
And do you take naps during the day?
3 to 4, those are my crush hours.
So you'd like to take a nap if you could?
I would love to.
And do you have the opportunity to do that every day?
Not really.
And do you play catch up on the weekend then?
Sometimes.
Okay. And tell me about other things with your health. Do you have any high blood pressure, any diabetes, any issues with
None.
sugar issues? No. No connective tissue problems, no problems with depression or anxiety?
No. Okay.
How long does it take you to fall asleep?
At least half an hour.
And is that because you have a lot of things on your mind, or because you're not that sleepy when you go to bed?
I would say it's a combination of both. Sometimes I'm not that sleepy, and sometimes I have things on mind.
And do you watch TV in bed? Do you have other things that
I
can
don't watch
distract
TV
you?
in bed.
Okay. And when you fall asleep, do you maintain your sleep during the night, or do you wake up a lot of times?
If they wake me up because I'm snoring, then
Okay.
I'm awake, or the kids.
Okay.
That.
But other than the kids waking you, you sleep throughout the night. You're not waking up 2 or 3 times to go to the bathroom or anything like that?
No.
Okay. And during the night, do you have dreams? Are you aware of dreams?
I would have sometimes dreams. Yeah.
Okay. And what about any nightmares or night terrors?
Not really.
Okay. And do you have any sleepwalking, sleep talking? Do you ever wake up in a dream where you can't get out of the dream?
No.
Okay. And what about taking medications? Do you take any medications for sleep?
No, I haven't.
Dali, tell me a little bit more. Have you had any problems where you've needed to have surgery for your nose or to breathe? Any deviated septum repair? Any tonsils removed? Any adenoids removed? Anything like that?
No, I don't.
Okay. And when you take naps during the day, do you wake up feeling more rested? Does it help you?
Usually I'm more tired.
You're more tired after the nap. And do you drink coffee during the day?
Yes, I do.
How many cups of coffee do you drink?
I would say 3 cups.
Okay. And then are you aware of grinding your teeth at night? Do you have any dryness of your mouth or any drooling?
I would say more dryness. Probably I am grinding my teeth. I would assume that I am.
Okay. Do you wake up with headaches in the morning?
Not really.
And has anybody ever told you that you move around a lot in your sleep? You thrash around?
No.
Okay, and do you have any restlessness of your legs at night before you go to bed, just in the evening?
No.
And have you treated with anybody else for the snoring and the lapses in breathing?
It's the first time.
And how did you find out about oral appliances for sleep apnea?
I was talking to some friends, making fun about my kids complaining about me snoring, and we started having all this discussion. And I just learned I might to go check.
So at this point, I'm going to have the nurse come get you, and we're going to get some baseline information like your blood pressure and pulse, and then I'm going to come in and do an exam, and we're going to go through and see what we find.
Okay.
See if you're a candidate for a mouthpiece for the snoring. And we'll also want to know whether or not it's just snoring. We'll maybe get a test or a study, or send you to somebody to check out and see that it's just snoring and not sleep apnea. Okay?
Right. Thank you.
Very good.
Hi,
Hello.
Talia. How are you today?
I'm good, thank you.
Great. So I'm going to take your blood pressure today
Okay.
and measure your blood oxygen level.
Great, thank you.
You can please bring your finger.
How are you?
I'm good, thank you, Dr. Simmons.
Good. Okay, so we've got your baseline information, your blood pressure and stuff, and it's good to see you're alive and your blood pressure is good.
I'm happy.
So now I'm going to go through and do the part of the facial pain exam and also jaw function exam. Just make sure you have no jaw pains, no functional problems, so that we can go ahead and see if you're a candidate for a mouthpiece, okay?
Okay,
But right now, let's take a look and see how your jaw works, okay?
sure.
So first of all, I'm just going to have you do a few neurologic movements and tests. I want you to follow the flashlight with me, okay? Excellent. And now I want you to look straight at me, and I'm just looking at your pupils to see if they respond to light. That's excellent. Now I want you to make some faces for me. I want you to puff up your cheeks. Good. Relax. Stick your tongue in your cheek. Tongue in this cheek. Stick your tongue out as far as you can. Close. Now smile big. Now frown. Ugh. Great. Now I'd like you to shrug your shoulders up. Up. Good. Now turn your head away. Now turn back into my hand. Good. Turn into my hand again. Good. Now squeeze your teeth really tight. Great. Now squeeze your eyes tight, really tight. Close them, tight, tight, tight. Great. Now I want you to squeeze my fingers. Can you do that really tight? Put them in the palm of your hand. Squeeze really tight. Go, go, go. Hard, 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 hard. Okay, and relax. Now I just want to see how the movement is on your arm. Just relax there. See the flexibility. Excellent. Now what I'm going to do is see that you can discriminate sharp and dull. So I'm going to show you on your hand. This is sharp and this is dull. Can you discriminate those?
Yes.
Close your eyes. What is this? Sharp or
Sharp.
dull? And
Sharp.
here?
Dull,
And here?
sharp,
Here?
dull,
Here?
sharp,
And here?
sharp.
Excellent. Okay, so now I'm going to take a look and see how your airway is and stuff. So the first thing I'm going to do is look and see your profile and how straight your nose is, and it's deviated a little bit to the right. Can you write that down for me, Dahlia, please? Okay. Yes, okay. And I'm looking in the nose, and I'm looking to make sure that there's no blockage. Now, would you breathe through your nose for me? Breathe really hard. Good, that's great. And now again, breathe. Okay, and breathe. And again, breathe. Hard. Excellent, okay. So, as far as airway, she's a good nasal breather. Are you able to breathe through your nose at night, okay? Or do you have allergies?
I believe so, no, I'm good.
Good. Now what I'm going to do is have you do some movements for me. I want you to open your mouth as big as you can without it hurting. And we are opening 52 millimeters, so that's great. Bite your teeth together. And now I'd like you to slide your jaw sideways for me as far as you can to one side. Go sideways. Excellent. Yeah, one side. Okay, and that's 10 millimeters. Go the other way, please. And that is 11 millimeters. Excellent. Bite your teeth together. Now I'd like you to slide your jaw as far forwards as you can. Slide your chin out. Excellent. And she's coming forwards. Close down on your back teeth. She comes forwards 11 millimeters. Now I'm going to listen to your jaw joint. Open big and close. Do you get noises in your joint? No. Is it sore here or here?
No.
Is it sore here or here?
No.
Now I'm going to load your joint. Close down and open and close and open. And there are no noises in the joint. I'm going to just load the joint a little bit more. Open for me. Close. Open. Close. Open. Close. Open. Close. And open. Close. Alright, so there's no jaw joint problems. Now open for me just a little. And I'm going to press on some muscles. I want you to tell me if they hurt you. If they're mild, moderate, or severely tender. And if they send any pain.
Okay.
Shoot any pain anywhere. So open for me a little. Anything?
No.
And here?
No.
And here? Okay, open again. Here?
I wait, maybe.
Little, mild.
Mhm.
Deep masseter on the left is mild. Nothing? Nothing? Okay, let's try on this side. Open again. Anything? No? Nothing? Nothing? Okay, open again. And there, nothing?
Yes, here. Yeah.
Mild. And mild in the right masseter at the zygomatic arch. Open for me a little. So now I'm going to press on some muscles inside. Does that bother you? No? Okay, and here? Temporalis tendon, nothing. Medial pterygoid, nothing. So we're going to do the other side. Nothing. You're all okay, right? Okay, great. So there's no muscle tenderness, no joint problem. Now what I'd like to do is check a bite contact pattern. So what I'm going to do is see if we can get you to bite your teeth together for me on your back teeth. Bite, open, bite, open, bite, open, bite, open, bite, open. And the overjet and overbite, let me just make sure I got those together. Bite together again. I think I wrote them, but let's just make sure. Her overjet is 5 and open a little. Her overbite is 3 millimeters. Excellent. So these are good findings, and it looks like there's no contraindication to you having a mouthpiece for the snoring. Okay? Okay, Dahlia, so we're ready to do some measurements. We're going to measure now your head and neck movements. So what I'd like you to do is just lift up your hair so I can measure your neck. Okay, there you go. Perfect, okay. And her neck measurement is 16 inches. Now 16 inches is a concern for us because it means your airway may be a little blocked. Let me just measure around your waist too. Can you touch where your belly button is? Okay. And here we're measuring at 43 inches. Okay. Now what I'd like to do is see you move your head and neck for me, okay? So just some simple movements. Touch your chin to your chest. Okay, Gila, that's 0 inflection. Her extension is full at 180. Look at me, please. Turn your chin over your shoulder. She rotates to the left 80 degrees and to the right. Come this way, please. To the right, she's going 85. Now come back straight. Put your ear on your shoulder. And lateral flexion is 40 to the left. Come this way. And she's 40 to the right. Look at me. Does it hurt when I push?
No.
No pain and compression of the cervical spine. Would you nod your head up and down for me? Great. AA movement's good. Put your chin on the chest. And let's do this. Okay. And lift your head up again. And nod up and down. Okay. So OA and AA movements are both good. Slide your jaw forwards. Good. Does that hurt you at all?
No.
Hold it forwards. Transverse process of atlas is not tender on either side, and it's not rotated. So now I'm going to bring this chair over. I'd like you to sit on this chair facing the television.
Sure.
Okay. And now I'm going to press on some areas of your back and neck, and I want you to tell me if anything hurts you. So I want to know, is it mild, moderate, or severe? And I'd also like to know, does it refer pain anywhere? So tell me, this is the infraspinatus. Anything? No? Part of the rhomboid? You're jumping a little, but it doesn't hurt you, huh? This is the levator scapula. Nothing? The upper trapezius, anything? No? Okay, now I'm going to press on the paraspinals. Nothing there. Let's do the infraspinatus on this side. Anything? Part of the rhomboids.
No.
This is now the levator scapula. Nothing.
But nothing.
Mild on the upper trapezius, if you can write that down, please. And nothing there on the supraspinatus. Now I'm going to do the posterior cervical muscles. Nothing. I'm just going to turn you sideways here. Just look straight ahead. And I'm going to do the muscles on your anterior neck. This is the sternocleidomastoid muscle, and again, nothing is tender.
No.
There's nothing there, and I'm just going to palpate and see if I can feel any lymph nodes or any tenderness there at all. Seem okay? Anything? Fabulous. Okay, we're going to take an image now of your jaw and upper airway. We're going to make sure your jaw joint's okay. We're going to make sure, because there was some stuff that I was a little concerned about on your previous image. And I'm also going to make sure that your jaw and teeth and airway look normal, okay?
Okay.
Bite your teeth together. Okay, I'm going to take the image now. Hello, you ready for the impressions?
Sure.
Okay, we're going to take the impressions and we're going to do a bite on you, and we're going to get it all ready for the lab, okay? So first of all, I'm going to take the lower impression, because that's usually a little easier. Okay, I'm going to put this in the mixer. Okay, you ready?
Yes.
Here we go. Sit your head back. It's set. I'm going to just pop it release it. Wonderful. We got a nice impression of you. Now we're going to do the next one. Okay? And again, here's the impression. It shows all the teeth. That's excellent. Now my next step is to do the bite.
Okay.
So now this is going to fit on your teeth. I want you to bite forwards. Open for me. Bite regular. Okay. So I'm going to take a bite in that position now. Okay, so open for me. Open your mouth together. And now I want you to come forwards and bite. Okay, open. Okay. You good? Excellent. Okay, Dahlia, so this is the one that you've chosen that you want to use. This is the key that you're going to be able to put in, and you turn it clockwise.
Okay.
And I'll give you more detailed instructions when we fit it. What I'd like you to do is read the informed consent, and then I would like you to sign on the second page that you've read everything. I want you to have the opportunity to ask me some more questions.
I actually do have some questions, and I wanted to find out if you think this is the best one to fit my situation.
Well, there's advantages and disadvantages to each one. There is no one right mouthpiece, or we wouldn't have 100 different choices that are even possible. The ones that I give patients as an option are the ones that have had the most research, have been studied by independent people, not the people that actually are selling the appliance or providing and manufacturing it. So I'm confident that these are all good. I can't tell you that one is better than another because we don't have research that supports it. So we tend to pick the mouthpiece based upon your circumstances. For instance, if you had a very big tongue, I would not want a mouthpiece that would constrict or restrict your tongue. I would want your tongue to go forwards. This particular mouthpiece doesn't have the ability to stop your tongue or give your tongue more room. In other words, I think this particular mouthpiece is an advantage to you because it's easy for you to adjust. Although it doesn't give you the most tongue space, it seems to be the easiest one for you to use. You were looking at the other ones and adjusting it and adjusting them, and you saw that that one was sort of the easiest one. Also, people do quite well with this one. They can take it in and out quite easily. And it doesn't have bars at the side which can irritate your cheeks, and your cheeks are already a little bit irritated, so I didn't want to irritate them. So when you weigh everything up and down, you might say, is one clearly better? And the answer is no. There is no one that's clearly better. A lot of it is personal choice or nuances that the doctor will pick up and go, in your particular case, this one would be better. I sort of like this one because it will help you keep your mouth closed and because it helps you adjust it much easier. You can do the adjustment without worrying about it too much.
I got it. I have a question. My other question is, would it cause some mouth soreness for me?
Yes, you know, typically people will say the first week or few weeks they can get some jaw soreness. And that's why if it is sore the first few weeks, we tend to tell you, don't advance it. Don't bring your jaw further forwards. In fact, sometimes we actually have people bring their jaw backwards, or sometimes we have people use it every second night for a little while until they get used to it. It's almost like asking you to run a mile or 2 miles if you hadn't been running. You'd be very sore if you did that for 2 days or 3 days or a week in a row. So we tend to work you into it. Now, once you're used to wearing it at that position, and we may give you a few days to a week at that position, we're going to have you gradually bring the jaw further forwards until you feel like, wow, I'm better rested, and you're getting reports back from your children, you're not snoring anymore, and you don't really have to have those daytime naps so much. Those are sort of clues to me that you're doing better. So we want restful sleep, less noise when you're sleeping, and we want you to be able to adapt without getting your jaw sore. Now, if you do have soreness, I want you to call the office. We will check on you in 3 days. That's our typical protocol, is to reach you within 3 days to make sure you're doing okay. So don't hesitate to call us if there's any other issues.
Thank you. And the last question I have is, how do I maintain it as hygiene?
Okay, that's a great question. Well, basically, I like people to brush it with toothpaste and a toothbrush like they would normally brush their teeth, and consider it something like a dental appliance, like a retainer. So I don't really like people to put it into harsh chemicals. I have had people do some things to try to clean their mouthpiece, like boil them. That will ruin it. That boiling it will soften it up, and the acrylic will denature and it won't work anymore. Leaving it in a hot car is another problem that people sometimes will run into. The other last thing I want you to be careful about is leaving it around pets. If pets can access it, they'll chew it up because it's their owner, and they love their owner, so they'll chew it up. And of course, if you want to look after it with toothbrush and toothpaste and rinse it, I basically tell people scrub it, rinse it, shake it dry, put it in the box, but don't close the box unless there's air holes, because otherwise it will grow some fungus or some other kind of molds, okay? And as far as every now and then, like once every few weeks, you can put it in a cleaner, but don't leave it in a cleaner for a day. Just leave it in the cleaner for about 10 to 20 minutes. Follow the directions of the cleaner and don't use anything harsh. So no chemicals other than dental cleaning materials. Try to just brush it with toothpaste and toothbrush. Keep it away from heat and keep it away from pets, and you should do very well. I have people with them for many years and they do very well. Victor, good morning to you. How are you?
Hey, Doc.
It's nice to see you. So I heard that the nurse came in and checked you and everything's good. So you're all set to have your mouthpiece today?
Yep.
Okay, so this is exciting. So you've been snoring every night. Now we're going to see what happens, huh?
Perfect.
Are you ready?
Yes, I am.
So let's start by fitting the mouthpiece. And I'm going to show you what it looks like.
Okay.
So there's an upper, this is the lower piece, and an upper piece. And you're going to adjust it by turning the screw here. And I'm going to show you how to do it. But this mouthpiece has a little arrow there. And it has a screwdriver. And I'm going to show you how you adjust it. And you're going to adjust it on both sides. So here I put the key into the little hole. And as I turn it, it's going to advance this piece.
Okay.
Now when it advances that piece, it's connected to your jaw. And it's going to move your jaw forwards. And that's how it works.
Okay.
So let's start by fitting the top piece. Now I'm going to fit the bottom piece, and this is the order you have to put it in, because it's very hard to put the top piece behind the bottom piece wings. Now that's holding your jaw forwards a long way. Do you feel it? Now I'm going to take it out, and the way I take it out is the bottom piece first,
and then the top piece. Now these are not connected together.
Okay.
So if your mouth keeps dropping open, then we're going to need to put a connector between them or give you a mouth, head, jaw strap, okay? So I'd like you to put it in. You can try putting it in the two pieces together,
Okay.
or you can try putting it in the top piece first. Okay, that was pretty easy. Okay, let's see if you can take it out for me. Pop it out. Excellent. Okay, excellent. So what I'd like you to do is wear this in this position for about a week, and then you can start turning the screws forwards, one turn at a time, every 3 days, until you find that you're not snoring. If you don't get any feedback from a bed partner about snoring, then what I'd like you to do is depend on either an iPhone app that will record you snoring, or you can actually rely on how sleepy you are in the morning. If you feel well rested, it's more likely to be working.
Okay.
Now, if you wake up with headaches, or you have to go to the bathroom a lot of times, those are usually indicators that it's not working so well. If you sleep all through, don't need bathroom visits, don't have a morning headache, those are good signs. Okay, now this is the morning positioner. This is also blue, it's color coordinated just for you. I don't do that for everybody. But now what we're going to do is we're going to put that in, and I want you to bite on it, and I'm going to get my fingers out of the way first, and you're going to bite on that and squeeze your teeth together. Good. Now when you do that in the morning, that's going to help recruit you seating the jaw joints. And the way it works is by squeezing your teeth together, it brings your jaw back into position. Okay? So now you can pop that in and out a couple of times for me. Good, and pop it back in again. Excellent. Okay, and squeeze. Now, how do you know that it's worked? When you bite your teeth together now and squeeze, do you see how you can feel your back teeth contact? Okay, that's important because that shows that your bite is firm and stable. When I put this in, it's a piece of paper, bite, it sticks. Open, bite, it's cement. And when you come back and see me in a few weeks, I want to make sure that you're still biting on those teeth. So tap your teeth together at the back, get the feel for that. That's what we're looking for. That's your position of stable bite. So we will see you again in 3 weeks, but we'll definitely call you in about 2 or 3 days to make sure you're using the mouthpiece and you're okay. The nurse will go over instructions on use and care. And if you have any other questions, you make sure you ask her. And then we'll look forward to see you in a few weeks, okay?
Thank
It's
you.
great to see you again.
Good to see you.
Dr. Simmons, thank you for allowing us to interview you. Can you tell us something about your interest in snoring and sleep apnea?
Well, from a personal aspect, I'm a terrible snorer. So snoring has always been something that I've tried to figure out how to deal with. And it started off when I was in my 30s that I started to snore with some significance. Prior to that, it wasn't an issue. So when I got tested for my snoring, it turned out that I don't just have simple snoring, I have sleep apnea. Now somewhere along the way, between not snoring, snoring gently, and having sleep apnea, I went from somebody that didn't have a problem to somebody that really has to address it. So from a personal point of view, I now have snoring that is just a sort of a telltale sign of something more serious. And that is the thing that sort of struck my interest in helping people that have snoring. The first thing, of course, is it's a social problem. If you're sharing a bed with somebody and you snore, neither you, the snorer, nor your bed partner is going to get good sleep. So it's kind of an important thing from a social point of view, even if it's just a benign snoring. But unfortunately, about half the people that snore, maybe a little less than half, they have sleep apnea. And sleep apnea is no joke. They have a lot of consequences, patients do typically when they have sleep apnea. There can be consequences such as high blood pressure, cardiovascular problems, strokes. Some people that have sleep apnea have issues with glucose intolerance, diabetes, they have reflux, depression. For men it's important they have impotence, that's very important to men, and also issues with brain damage. But certainly my point is, if you can catch snoring early on, perhaps you can prevent it progressing to more serious stuff like sleep apnea.
Why would a dentist be involved in sleep apnea?
Well, sleep apnea can be treated by several approaches. The most common approach and often the first approach, not necessarily the best one, is the breathing machine. The breathing machine works quite nicely if someone can tolerate wearing it. Unfortunately, about half the people that get these breathing machines aren't able to wear it. For no cause other than perhaps it makes them feel claustrophobic, or it's just so uncomfortable, or they move around a lot in their sleep. Let me give you an example. This is one of the breathing machines. This is as simple as it gets. It's nice and small and compact. This is the tube that connects to the breathing machine. And you connect to the breathing machine this way, and that seems very straightforward. And then you have to connect the machine with some electricity, and this connects to the wall, and that works quite nicely. For a lot of people, they can wear it. Unfortunately, if you travel a lot, that's a lot to carry around. The other thing is, if you like to camp or hike, it's certainly not something that you can just plug in on the outdoors. Unfortunately, it's not the only thing that people need. Sometimes they get their mouth so dried out from wearing the breathing machine that they need to have a second piece called a humidifier. And you put water in the humidifier and it clicks together nicely and it works again, and you plug it in, and again it can work very, very beautifully. It can be very neat and comfortable for people when they're going to sleep. It can fit like this and they breathe nicely, and it can help. The unfortunate thing about it is if you have to get up in the night to go to the bathroom, you have to unplug or disconnect, switch off the machine. It's a very good answer, but it's cumbersome. It's kind of a difficult thing to adapt to, and it's a lot to carry around, especially if you're traveling. Here's the comparison. This is the treatment with a mouthpiece, and you can see the difference. This is all I need, this is my carrying case, and I take it with me like this. That's the reason why dentists are involved. Now, there is a third option. We've talked about the breathing machine, we've spoken about a mouthpiece. The third option is a surgery. And there are different types of surgeons that can do a surgery. Sometimes it's a soft tissue surgery that's done by ear, nose, and throat doctors. And sometimes it's a hard bone surgery to move the jaws forward, and that's done by a maxillofacial surgeon.
Can any dentist do this?
Any dentist is licensed to provide a mouthpiece. They can provide a mouthpiece for snoring and sleep apnea. They should not provide a mouthpiece until the patient has been tested. This can be a mistake because the dentist is very well-meaning and wants to treat the snoring, but unless the snoring is being checked, you don't know that the mouthpiece is addressing the right thing. Some mouthpieces are made for snoring, and that doesn't really mean they're approved for treating sleep apnea. Now, how do you know somebody is qualified? And I would say that you should look on the website of the American Academy of Dental Sleep Medicine. If you can find somebody that is a diplomat of the American Board of Dental Sleep Medicine, a diplomat of the American Board of Orofacial Pain, somebody that has a certificate such as this, which is an accreditation certificate from the American Academy of Dental Sleep Medicine. There are a few places now, and they're beginning to get more and more around the United States. Just make sure you're going to somebody that really has the experience and background and training to really take care of you.
My name is Rob Relly. I'm an oral and maxillofacial surgeon, and I certainly appreciate this opportunity to speak with you today about what I do as a surgeon in managing obstructive sleep apnea. So many people would ask, why consider surgery when there are other proven alternatives, treatments like CPAP and oral appliances? Well, there are some instances where patients can have a very prominent narrowing of the upper airway or the breathing tube because the facial skeleton is so deficient. And this is a prime example here. If you see this patient who has a very, very recessed chin, when we look at their imaging, you can see just how far back the chin is and how this could certainly compromise the breathing tube. All of the muscles and the soft tissue that attach to the airway are attached to this facial skeleton. So when everything is so recessed, now that renders the upper airway much more collapsible, much smaller. And these really are the ideal candidates for maxillary and mandibular or upper and lower jaw advancing surgery. Now, this type of patient really is the more common sort of patient that we would see when we're considering surgery. Here, for example, is a gentleman in his 40s or 50s. This is the typical patient. He's got some recession of both his upper and lower jaw. We don't see the airway here on this type of imaging, but it would be located right where my pointer is, just in front of his vertebral column here. And we can see how when we advance the facial skeleton, we're enlarging the upper airway, but look also what it's doing. We're greatly, like enormously straightening out the profile. Many of these patients also have problems with their bite. They have overbites or recessed jaws associated with a bite problem. And so for these individuals who are often in orthodontic treatment, not only are we improving the upper airway, but we're correcting a serious malocclusion, and we're making a very dramatic enhancement of their facial aesthetics. People might ask, who would be a good candidate for this type of surgery? Well, we all know people that snore loud. Maybe our wife or our husband wakes us at night asking us to roll over, or maybe we have a spouse that snores very loudly or truly does have indications of obstructive sleep apnea. If these individuals have been tested and we determine that they do have sleep apnea and they've tried all of the other non-surgical forms of treatment, then these are candidates for surgery. These are the type patient that should come to see the oral surgeon and discuss what is available. The true beauty of maxillary and mandibular advancement type surgery is that it requires no compliance. These are patients who don't need to wear any sort of a mask every night. They're not committed to wearing an oral appliance. And truly, these happen to be the most grateful patients that those of us that do this type of surgery have an opportunity to treat.